After months of baking in the sun, you might be a bit concerned about your skin now. A ton of apps are now out there that promise to detect melanoma. Now, according to the Skin Cancer Foundation, nearly 5 million cases of skin cancer are diagnosed each year. So an app might be life-saving, but do they actually work? Joining us now is dermatologist Dr. Doris Day. Doctor, thanks for being here now. I'm looking at those statistics, and one person dies from skin cancer every single hour. So we might be done with the summer, but you have a warning for everybody.
Absolutely. Summer may be coming to an official close and you're putting away your summer whites, but it's not time to put away your sun protection, because the reality is that skin cancer can be very deadly, and it's the most common cancer. It's more common than breast, colon, lung, and prostate cancers combined.
It's scary to think of that, but with these apps that are out there, doctor, and there are two of them. There's Mole app, which based on screenshots says that it can help you, and then there's Mole Detective, also screenshots of moles. So are these apps accurate? Are they helpful?
I have two problems with apps. One is that you have to be the doctor to be worried about the spot. And what I find in my office is that many times when patients come in, they show me a spot that I can look at in 3 seconds and say, that's not important, and here's why. But this spot just next to it or in another area is very important, and I don't want you to leave the office with that spot still on you. That might be the melanoma. So a lot of times patients don't know the ABCDEs. They worry about things that are raised. And in ABCDE, there's no R. So raised is not always a criteria that we worry about as doctors. We look for asymmetry, border irregularity, color changes, diameter, evolving spots. So those are criteria that we look for. Plus, we have special lights called dermatoscopes that we can look at. We have devices that can help us, and we have experience.
Doctor, would you go as far as saying that these apps, giving the impression to people out there that they could, figure out their moles on their own, would you call them dangerous?
They can be dangerous because they can give you a false sense of security that one spot is okay, and it may or may not be okay in and of itself, and you may not go see the doctor for other conditions or other spots that may be harmful, and so you delay diagnosis in those ways. So right now, there's still no replacement for your doctor, and the experience that comes with dermatologists who look at skin all day long and who know how to diagnose, especially that potentially deadly form of skin cancer called melanoma.
Without a doubt. Dr. Day, you're always so helpful here, such a source of wisdom. We want to thank the Skin Cancer Foundation for supplying our Sun Smart supplies right here, which are advocated by, of course, Dr. Day.
Absolutely.
Get your sunscreen and your hat on and cover up, even though it's fall. Those apps, by the way, are under investigation and some scrutiny, I believe, by the FTC.
Yes.
Thank you, Dr. Day.
Thank you.
Baptism.